Hello and welcome to day one. Today we're going to talk about the male genital system. We're just going to give you an overview. Of course, the male genital system is the part of the reproductive system for the males. Produces sperm and male sex hormones. It also works closely with the urinary system, so they go hand in hand. It is important to just kind of understand this overview for diagnosis and procedure coding. What are the main organs of the male genital system? The testes, the epididymis, the vas deferens, seminal vesicles, prostate gland, and the penis and the scrotum. So these are the main organs. There are more organs, but these are the ones that you're going to hear the most about when you start looking at procedures and what needs to be treated. These are what you're going to see. The testes and the scrotum produce sperm and testosterone. They are located outside the body in the scrotum. So the testes are located in the scrotum outside the body. The scrotum, of course, helps to regulate the temperature for the testes, which is essential for sperm production. The epididymis and vas deferens, sorry, that word just, woo. The epidi, I'm gonna call it, stores and matures the sperm. So it goes in, it's made, then it goes in there and it helps to mature it. Vas deferens is what transports sperm during ejaculation. Sperm movement is controlled by muscle contractions. When you think about a vasectomy, that's a procedure done in the male genital system. That procedure involves the vas deferens. As you can see, the vas deferens transports the sperm. We're trying not to, we're trying not to have him transfer any more sperm, so the vasectomy is going to cut that off. Seminal vesicles and prostate gland. So seminal vesicles produce fluid that nourishes sperm. Sperm has to be nourished or else it can't be productive and healthy. Prostate gland adds fluid to semen, and that's very important. That's why when the prostate, when there are problems with it, it can be serious. Prostate surrounds the urethra. The prostate conditions are common in older males. So you mainly see older males that have prostate conditions. You probably heard of prostate cancer. You might have heard, like, if you have a grandfather or an older father talk about it, and that's why you mainly hear that in older people. Can it happen in younger people? Yes, but it is just more common in older people. The penis and the urethra. Of course, the penis allows sperm and urine to exit the body, so that's what that's for. The urethra carries the urine and semen, so the urethra carries it to the penis where it exits the body. Erectile tissue fills with blood during arousal. So it's important to understand these structures for procedure and diagnosis coding, because you want to make sure that you know what they do and that you're kind of matching them with the right procedure. Common male genital conditions, benign prostatic hyperplasia, and you'll hear that referred to as BPH. Prostatitis, that's an inflammation of the prostate. Prostate cancer, we talked about that. That's what's more common in older people, older males. And then the epididymis and testicular disorders. That's it. Have a great day one.